Chan. I'm the program coordinator at Arthritis Consumer Experts. I'm joined here today at the Arthritis Broadcast Network with Mary-Anne Fitzcharles. And welcome, Mary-Anne. Welcome back, I should say. You did an interview for us last year.
Pleasure.
And maybe for those watching us this year again, do you want to give our audience a short introduction of yourself?
Sure. I'm a rheumatologist. I've been at McGill University for probably nearly 30 years.
Yep.
I have a particular interest in pain related to rheumatic diseases, and I've worked in this area for many years. And I think what is happening today is very pertinent to our patients because we have wonderful new drugs that have had huge impact on disease activity, particularly patients with inflammatory rheumatic diseases. However, even in that context, our patients still continue to suffer, and pain continues to be a very important part of suffering. So this is my area of interest and perhaps expertise.
So we're in Quebec City, and you say you were able to walk around the carnival just now? Or
Absolutely, I had a good walk outside. It's a little chilly. It's sort of minus 22 degrees. You have to really button up and put something on over your head and a scarf around your neck.
Yeah.
But it's invigorating. There is sunshine, and sunshine makes a big difference to us.
Aside from walking outside, I know you had a chance to enjoy the conference. You had your talk yesterday, I believe.
That's right.
How was asking about the conference? What do you think is the most exciting thing coming out of this conference this year?
Well, it's still early days. We're only in the second day of our meeting, and it started last night. But there've been two really, really interesting podium presentations, and I think really they demonstrate to us the two balances which are very important in rheumatic diseases. And we had a presentation last night from a basic researcher who is looking at genetics and proteomics and these very complex things in rheumatic diseases. And I think that this is the way the science is going to go. So we have diseases where we can identify the disease, but all patients don't respond in the same way. And I think these very sophisticated genetic studies, these genetic measurements, the measurements of how a gene responds in a particular patient is going to help us identify how best to treat our patients in the future. So this is terribly, terribly exciting. And that's sort of the one end of the balance. And I think the other counterbalance was an outstanding presentation that we had this morning by a psychologist who really impressed upon us how important patient collaboration is in management. And we really are looking at our patients today as patient partners. No longer are we the physician or the healthcare professional who is telling the patient what to do, because that doesn't work. Our patients really have their own minds. They have their own agenda. They come with their own understanding. And it really opened up our eyes to the importance of an alliance between the patient and the physician. So it was really a balance of the extreme of science, but the human understanding.
And while we're on the topic of human understanding, I know social media is getting bigger and bigger between healthcare and rheumatologists. So in terms of this year, what do you think about social media in terms of patient care and healthcare professionals?
I think it's very important, but it frightens me. I'm still a pencil and paper person, and I know that at this conference we can access the whole program on a WhatsApp and all that. I'm very proud that I can now text my children on my telephone. So it's called little steps at a time. So, but certainly for the young people and the young residents in our programs and fellows in our programs, this is the important step. And I think us oldies, we're going to have to learn, and we've got to follow on. But my steps are very small steps at this stage.
Well, every step counts, so we're really
You're right.
happy you're taking that step. You did a presentation called 101 Joints on Joints.
Mm-hmm.
Can you share with us some key highlights from your presentation?
So we were really talking about the whole issue of particularly herbal cannabis in the management of patients with rheumatic diseases. And I really don't like to focus only on herbal cannabis. I like to think more about the whole cannabinoid system. And if we take two steps back, we've got to bring the science parallel with our patients. We have to think of the law, and we think of our responsibilities, our ethics to our patients. So if we think of the science, the endocannabinoid system is a very important system in our body. It's a system that really brings the body back to equilibrium. So when we need to be vigorous, when we fight or fly, our fight and fly mechanisms go into overdrive.
Yep.
And if they stayed in overdrive, well, we'd probably just burn up. But we have to be able to move ourselves back into equilibrium. And this movement back into equilibrium is via the endocannabinoid system. So the system is very important. It has importance regarding stress reduction, appetite, anxiety reduction. This is really important. So this is where we are with the science. We now have some cannabinoids which are able to be taken exogenously, so products that we can take. And to date we have 3 different cannabinoids. We have the endocannabinoids, which are in our body. We have pharmaceutical cannabinoids, or syntheto, which are manufactured in laboratory. And we have phytocannabinoids, which are really in the plant material. And I'm now going to move into the area of herbal cannabis, or the phytocannabinoids. There has been a huge public advocacy for the use of herbal cannabinoids in patients, particularly with rheumatic diseases. I'd like to remind you that when you look at herbal cannabis, which is the plant Cannabis sativa, there are more than 400 molecules in this plant. We know that the 2 important molecules are tetrahydrocannabinol and cannabidiol. Those are the 2 that have been studied most. The THC, or tetrahydrocannabinol, is the one that gives us the boost. It gives us the psychoactive effects.
Yes.
We believe that cannabidiol has got very, very important mechanisms and very important functions regarding pain. When you take a product such as herbal cannabis, you are taking a whole melange of molecules. Now, there are many people that have advocated and that have had experience and that have told us that when they use herbal cannabis, they really feel much, much better. They were more relaxed, pain is better, sleep better. And I think we have to respect these opinions. However, we do not have the scientific study yet. And as a physician, and as an academic physician, and as a clinical scientist, we have to demand the science. So that's the first thing. The second aspect is concern for the well-being of both the patient and society. And there is mounting evidence that there are important negative effects related to herbal cannabis in patients and in people using herbal cannabis continuously. We do not have this evidence in our patients because the studies have just not yet been done. So the evidence for risks has been garnered from recreational users who are mostly young, healthy, vigorous people.
Yeah.
And that we know cannot be translated into our patients with arthritic disease. So we have the science, we have our patients who many of them report important positive effects. We have a mass of herbs that we really don't know what's in it. We have some pharmaceutical preparations, and in fact in Canada we have only two. We have Sativex, which is a spray, or a mucosal spray of THC and cannabidiol, and we have the synthetic preparation, which is Nabilone, which is THC synthetic. And unfortunately, we have very few studies in patients with rheumatic diseases. In fact, in the whole world, they've only studied 207 patients, which is almost nothing.
And even on regular news coverage regarding any sort of medical marijuana and whatever politics may be involved with that, it's just based on regular people, recreational use, not anyone with
So
rheumatic diseases.
that certainly is what the risks are related. The patients reporting good effect. This is in the medical world what we consider to be anecdote. And as a scientist, we cannot move forward only on anecdote. So the products have got to be properly studied.
In regards to for people living with rheumatic diseases, what would you recommend for them to maintain healthy joints?
So let's look at it from the aspect of pain management. I'm not going to go into the management of the underlying disease, but from pain management. And what we know is so very important. We really want our patients to take control of their disease. We want them to take control of themselves. And this is what we call locus of control, a strong internal locus of control. We want people to be active participants in healthcare, not passive. We want people to move away from saying, I feel so bad, I just need another pill. There might be other things we can do. So having a positive attitude, getting out, enjoying the sunshine, being physically active, all of these things that we know are really good for global health. These have to be part of the management of our patients.
In terms of people who have joint injury from participation in sports, then they're at higher risk of developing arthritic diseases. What would you recommend for them in terms of preventing that from happening?
Right. So I think what we're talking about is we're talking about secondary osteoarthritis. So when we think of arthritis, we can think of inflammatory arthritis, which what we understand just comes out of the blue. This is particularly conditions such as rheumatoid arthritis, systemic lupus. We don't really understand what sparks it off. There's a second condition which we call degenerative arthritis or osteoarthritis. And this occurs, it's sort of a natural development with aging. As we get to be in our mid-60s, we will get little knobbly fingers, and that is osteoarthritis. That is part of probably an aging process. However, there is osteoarthritis that is induced by joint damage. And there is no question that vigorous, terrible, very vigorous physical activity can induce damage, such as perhaps someone who's been a star world-class soccer player all his life. But I think the average person who participates in normal, good physical activity should not be worried that they're going to be damaging their joints.
Okay, that's
So
great.
good
news
nice,
to know.
level-headed physical activity. And I think the message is that if you're doing something and it's painful, cool it down a little bit.
Great. Thank you so much, Mary-Anne. Before we conclude, do you have any other message you want to share with our audience? Or?
No, I think other than to say that when we have patients who are living with a chronic disease, we really want people to continue life as normal as possible. We want the person to have their disease, if possible, put it there, but carry life on. And that should be the objective.
Thank you so much, Mary-Anne, and I wish you enjoy the rest of the conference.
Thank you.
And Quebec
To you
City.
too.